Perhaps if you're from technique peak. Take a look at a nice easy way to see if there's a closing issue or extension side bend to the same side issue in the lumbar spine. You could do your regular quadrant test, but sometimes it's a lot for people and they don't quite get it and they're all over the place. One of the ways to do it is, first of all, when you start, I always put my foot between his feet and bring your feet closer, right? And touch my foot a little bit more, because let me out. What's going to happen is that if they go too far out, you're going to change all your neural dynamics. So starting position is consistent. You can have hands on hips, and you can just say the patient going to lumbar extension, further, further, farther as you can go, a little bit stiff, come back up. And then let's say we're not sure, the body stiff at all? Okay. And let's say I want to see how the right side is. I could have him go right side extension, side bend, rotate. Or I could say, I want you to do, Justin, is do an anterior tilt. Let's see if you can. So now he's an anterior tilt. So that's extension. At the same time, now side bend to the right. And that shuts off. It closes that area quicker. Come back up and relax. Good. Go to anterior tilt again, which is fat position. And now tilt this way. Interesting part with Justin, you can kind of see it's easier. Your hands can come off your hips if you want. Right? And relax. So when you go into anterior tilt again and side bend to this direction, there we go. Come back up and see it compared to go forward again and then tilt into this direction. So with Justin, it's a little bit more blocky when we go into extension on the right. Let's use that information. We start thinking, if you can't close on one side, we start thinking more jointy, discogenic stuff. We start thinking more flexion extension bias. So this is a quick way to get to that quicker. So for Justin, say we think he had issues and that was his pain, right lower lumbar, and we did that extension, we would do a technique, an opening technique, a closing technique, whatever it would be. We would come back and retest that way. So it's actually a clean way to find that mobility in that lower lumbar region. Perhaps if you're from technique.